Considerable attention has been focused on developing and disseminating new techniques for neonatal care to new practitioners. The worldwide dissemination of the neonatal resuscitation program, including helping babies breathe, is an example of the programs designed to help and develop and enhance skills around the world. Much less attention has been paid to the value and needs of the existing workforce as it ages. Nurses, doctors, and all health professionals are subject to the same age-associated changes as the rest of the public, but with special challenges as it relates to providing bedside neonatal care. There is a small literature specific to describing the needs of the aging bedside nurse, and it is very little specific to the NICU nurse. Several reports, most notably Wisdom at Work, the importance of the older and experienced nurse in the workplace from the Robert Wood Johnson Foundation, emphasize the great value brought to the bedside by the experienced older nurse. In the United States, the average age of the practicing nurse is 46 years old, and several authors have studied the needs and value of the older nurse, defined as age 55 to 64. In many units, the older nurses form the backbone of the unit, providing an invaluable resource to clinical care and to the continuing development of new nurses entering bedside practice. Studies have shown that older nurses bring technical skills, experience, and a love of nursing, modeling nursing practice for others. In our unit, these nurses have called themselves lifers in recognition of the lifetime of experience and commitment they bring to the unit. Studies have also identified challenges for the older nurse. These include physical and mental changes associated with aging in general, challenges associated with changing in hearing, vision, and orthopedic issues, challenges associated with practice change, and time constraints. Physical changes for older nurses include head, neck, and foot problems, and aging nurses may be increasingly challenged with issues related to the heavy physical demands of the profession. Age-associated change in mobility, vision, and hearing may also present practical challenges. Studies have shown that experience and wisdom increase with age, while other studies have refuted the popular notion that the older nurses are unwilling or unable to learn new techniques or accept change. The needs of the aging physicians have also attracted increasing attention. Older physicians increasingly function as master physicians, relying increasingly on wisdom, experience, and pattern recognition to make decisions and provide care. A significant percentage of physicians in the United States continue to practice into their 70s. Many hospitals are considering systematic evaluation of the physical and mental status of the senior physician as a component of hospital credentialing. As the workforce ages, it will be increasingly important to provide accommodation for the aging nurse and physician. Design of inpatient and outpatient facilities and equipment needs to support easy accessibility and the special needs of older providers. Ergonomics are important in recognizing anthropometrics, biomechanics, situational analysis, and prevention. These issues are important for all workers, but especially for the older worker. Particular issues for older workers include reduced muscle mass, bone and joint problems, and mobility. Visual acuity and hearing may also diminish with age, and attention should be provided to good lighting and noise management. Eye strain has also become a greater issue with increasing usage of computers. Equipment design should consider the needs of the older practitioner, including attention to ergonomics and the variation in practitioner hearing and vision. In the NICU, while our patients are small, the equipment required for continuing care is often heavy and challenging to move or replace. Heavy equipment, such as the incubator, needs to be easily moved and maneuvered. Attention to the needs of the aging nurse and physician will enhance retention of these skilled providers in the workforce and allow the accumulated wisdom of experienced providers to lead and guide practice in the NICU.